Alright, so this is the initial newborn assessment. This is the newborn Ava. And let's get balanced. There. Alright, so Ava has just been born and I need to do her initial assessment. I have clean hands and gloves. I am going to start with suctioning her, and so this is my makeshift suctioner. So I will go in alphabetical order. I'm going to squeeze in the bulb and I will start with her mouth. I'll suction one side of her mouth and squeeze it out. I'll squeeze the bulb, suction the other side, squeeze it out. Now I'm going to do her nose, one nostril and out, and the other nostril and out. So she has been suctioned, her airway seemed clear. I'm going to take my clean sterile towel and I need to dry her eyes from the inner to the outer canthus and inner to the outer canthus. They are now dry, and so I need to dry her all the way off. I have a sterile dry towel. I'm going to kind of vigorously dry her off. It might make her upset, but that's good. We're stimulating her. And this towel is wet, so I'm going to switch it out and get another sterile clean towel. Use that one, and she is dry. So she'll lose most of her heat through her head, so we want to go ahead and get a hat on once I've assessed her fontanelles and her head. So I'm putting her hat on. There you go, Ava. She'll be a little warmer. I'm going to check her features for symmetry. I'm going to check her nares for flaring. I'm going to check her mouth for circumoral cyanosis and chart any of that after this assessment. She has her hat on now. I've assessed her face and head. I'll assess her cord. And she has 2 arteries and 1 vein, which is what she should have, so that is good. I'm now assessing her spinal column. I'm looking for any dimples, redness, bleeding, abnormalities at all, curvature, and her spine looks good. Since she's all dried off and has her hat on, has been assessed, I'm going to assess her genitalia. There's a little bit of drainage, but that's normal from hormones, so we will clean her up and get her diaper on. And so those things are done. Now I need to get her footprints. So I have her ink and I have her left and right footprint card paper. I will ink her foot and roll it onto this paper. I will ink this foot and roll it onto this paper. The one thing I forgot to do is her APGARs. And so for her APGARs, 10 would be perfect, but she is brand new. She still has some cyanosis on her extremities, and so she is going to be an 8. Alright, footprints are done. The APGAR, we'll go back and say I did that before she got her diaper and when I was doing her assessment. And now she needs her identifying bracelets. These have mom's name. They need to go on opposite extremities, so it's going to be on this foot. Tight but not too tight. Also, you don't want it so loose it's going to fall off. And here is the other identifying band on her opposite extremities and sides. I have erythromycin ointment, and that is to keep her eyes to prevent from getting any infections, and I'm going to apply from the inner to the outer canthus. And I need to swaddle her, so I'll swaddle and bring this up and swaddle. But you know what I forgot to do is weigh her, but that's okay. So I can find a hat, a diaper, and the same blanket, and I'll zero the scale and I'll put those on the scale first and weigh that. Now I'm going to take those off and I can put Ava with everything she has on that I've already zeroed the scale off of, put her on and weigh her, and then subtract that difference. Now that she has been weighed, she will go with Mom for kangaroo care. And so this swaddled blanket would come off to where her chest can be on Mom's bare chest, and the blanket can be draped over her back so that she does not lose any heat. She also has her hat to prevent that. And that is the initial newborn assessment. Thank you.